Bismillahirrahmanirrahim. Assalamu alaikum, everyone. Quote of the day is the seeking of knowledge is obligatory for every Muslim. Assalamu alaikum, everyone. I am Dr. Malina Akhtar, PGR Community Medicine. Today, my topic of presentation is Wilcoxon Grant Sum Test. I am presenting this topic under the kind supervision of Professor Dr. Saira Afzal. Learning outlines. Introduction of Wilcoxon ranks sum test steps in assigning assumption in Wilcoxon sum test statistics for a Wilcoxon rank test, key concept, recent updates, and MCQs. Learning outcomes. At the end of this presentation, participant would be able to describe about introduction steps in assigning test for Wilcoxon and test along with recent updates in the end. Introduction. The Wilcoxon rank test or Mann-Whitney test, a popular non-parametric test to compare the outcomes between two independent groups, is the Mann-Whitney U test. The Mann-Whitney U test, sometimes called the Mann-Whitney Wilcoxon test, the Wilcoxon rank sum test, is used to test whether two samples are likely to derive from same population, that is, that the two populations have the same shape. And some investigators interpret this test as comparing the median between the two populations. Recall that parametric test compared the mean H naught, that is mu1 equals mu2 between the independent groups. In contrast, the null and the two-sided research hypothesis for the non-parametric test are stated as follows. H naught null hypothesis is that two populations are equal versus alternative hypothesis is two populations are not equal. This test is often performed as a two-sided test, and thus the research hypothesis indicate that the populations are not equal as opposed to specifying directionally. The Mann-Whitney U test is preferred to a t-test when the assumption of normality is not met. The Wilcoxon assigned rank test is a non-parametric test for assigning whether two related or paired samples of observation come from the same distribution. It is a non-parametric alternative to the paired students t-test. In the Wilcoxon test, the values of the data for both samples are combined and then ranked. If the null hypothesis is true, meaning that there is no difference in the population distribution, then the values in each sample should be ranked approximately to the same. Therefore, when the ranks are summed for each sample, the sums should be approximately equal and the null hypothesis will not be rejected. If there is a large difference in the sums of the ranks, then the distribution are not identical and the null hypothesis will be rejected. The first test to be considered in the Wilcoxon rank sum test for independent sample. For this test, both sample size must be greater than or equal to 10. Formula for the Wilcoxon rank sum test when the samples are independent. This is here is the formula. Sorry. Mu or is equals to n1 into n1 plus n2 plus 1 divided by 2, and then square root the sum of rank for small sample size n1, and n1 equals small of the sample sizes, n2 is the large of sample sizes, and 1 should be equal to or greater than 10, and n2 should be equal to and greater than 10. Note, if both sample size are same size, then either size can be used as n1. Wilcoxon rank sum test. Step 1, state the hypothesis and identify the claim. In step 2, find the critical values, use the table. Step 3, compute the test value, and that is Combine the data from two samples, arrange the combined data in orders, and rank each values. Sum the ranks of the group with a smaller sample size. Note if both groups have the same sample size, either one can be used. Use this formula to find the test values. This is formula is shown here, where R is the sum of rank of the data in the smaller sample and N1 and N2 are each greater than or equal to 10. Step 4 is make the decision and step 5 is summarize the result. A one-sided research hypothesis is used if interest lies in detecting a positive or negative shift in one population as compared to other. The procedure for the test involves pulling the observation from the two samples into one combined sample, keeping the track of which sample each observation come from, and then ranking lowest to highest from 1 to and 1 plus and 2 respectively. In a Wilcoxon rank, some test ties within one sample may affect the decision process. For example, consider a phase 2 clinical trial designed to investigate the effectiveness of a new drug to reduce the symptoms of asthma in the children. A total of n equals 10. 10 participants are randomized to receive either the new drug or a placebo. The participants are ranked to record the number of episodes of shortness of breath over 1 week period following the receipt of assigning treatment. The data is shown as above. In the placebo group, 7, 5, 6, 4, and 12, and in the new drugs, this is 3, 6, 4, 2, and 1. Is there a difference in the number of episodes of shortness of the breath over 1 week period in participants receiving the new drug as compared to those receiving the placebo? By inspection, it appeared that participants receiving the placebo have more episode of shortness of breath, but is this statistically significant? In this example, the outcome is a count, and in this sample, the data don't follow a normal distribution. This frequency histogram of the number of episodes of the shortness of breath. In addition to the sample size is small and 1 equals and 2 equals 5. So a non-parametric test is appropriate. The hypothesis is given below and we run the test at the 5% level of the significance, that is alpha is 0.05. Here is a null hypothesis is two populations are equal versus alternative hypothesis is the two populations are not equal. Note that if the null hypothesis is true, that is the two populations are unequal, we expect to see similar number of episodes of shortness of breath in each of the two treatment groups. And we should expect to see the same participants reporting few episodes and some some participants reporting few episodes and some reporting more episode in each group. This does not appear to be case with the observed data. A test of hypothesis is needed to determine whether the observed data is evidence of a statistically significant difference in our populations. In the populations, as the outcome variable is skewed and the sample size is small, a non-parametric test is required. The Wilcoxon rank signed rank test is to use. The Mann-Whitney use should be used if we had two independent groups where we wish to compare the WBC count from a sample of the sick patient with the WBC counts from the sample of the healthy patients. Assumption of the Wilcoxon rank sum test. The base assumption necessary to employ the rank sum test is that the data are from the same population and are paired, and the data can be measured on at least an interval scale, and the data were chosen randomly and independently. The Wilcoxon rank Sign rank tends assume that there is the information in magnitude and sign of difference between the paired observation as the non-parametric equivalent of the paired student t-test. The signed rank can be used as an alternative to t-test when the population data does not follow a normal distribution. The first step is to assign ranks, and to do so, order the data from the smallest to the largest. This is done on the combined or the total sample, pooling the data from the two treatment groups and assigning rank from 1 to 10. We also need to keep track the group assignment in the total sample. Here is the data of the placebo, total number of episodes in the placebo group and new drugs group. Then we will arrange the data from the small to large, and then we will give them ranks. Ranks the data. That is 1, 2, 3, 4, 5. And if both are, if in both the groups it is equal, then we will sum and then divide it by 2 to the both ranks, that so that we rank them 4.5. First, we sum the ranks in each group. In the placebo group, the sum of the rank is 37. In the new drug group, the sum of the rank is 18. Recall that the sum of the rank will always equal to n into n plus 1 divided by 2. As a check on our assignment of ranks, we have n into n plus 1 divided by 2 equals to 10 into 11 divided by 2 equals 55. Sorry, 5.5, which is equal, 55, which is equal to 37 plus 18 equals 55. For the test, we call the placebo group 1 and the new drug group 2. Assignment of the group 1 and 2 is arbitrary. We let R1 denote the sum of the rank in the group 1. That is R1 is equal to 37, and R2 denotes the sum of the rank in group 2, that is R2 is 18. If the null hypothesis is true, if the two populations are equal, we accept R1 and R2 to be similar. In this example, the lower values, lower rank, are clustered in the new drug group, group 2, while the higher value, high ranks, are clustered in the placebo group, group 1. This is suggestive that but is the observed difference in the sum of the ranks simply due to chance? To answer this, we will compute a test statistic to summarize the sample information and look up the corresponding values in a probability distribution. The Wilcoxon sign rank test makes no assumption about the distribution of data. The Wilcoxon's sign rank test consider the difference between paired observation where the two groups are not independent. Test the statistics of Mann Whitney U test, which is U1 equals to N1 into N2 plus N1 into N1 plus 1 divided by 2 minus R1, and U2 equals N1 plus N2 plus N2 into N2 plus 1 divided by 2 minus R2, sorry, where R1 equals sum of the ranks of the group 1 and R2 and sum of the ranks of group 2. That is now U1 equals to 3 after putting values in the formula, and U2 equals to 22. Key concept. For Mann-Whitney U test, the theoretical range of U is from 0, complete separation between groups, where a null hypothesis most likely false and alternative most likely false and alternative most likely true, to N1 and to little evidence in the support of alternative hypothesis. In every test, U1 plus U2 is always equal to N1 and N2. The sample above U can range from 0 to 25. Smaller values of U support research hypothesis, that is, we reject null hypothesis if U is small. The procedure for determining exactly when to reject null hypothesis is described below. Sorry. I'm sorry, there is the missing of my slide. I will update this again. Now coming to recent updates. Mistakenly, I have deleted my slide. Now coming to the recent updates, what's the new? On Wilcoxon ranks some tests for the condition monitoring and the fault detection of the wind turbine. In this study, the Wilcoxon ranks some tests on non-parametric statistical test methods in the field of statistics have been exploited for the operation, state monitoring, and automated fault detection of the wind turbine. A five-step computation procedure has been developed in which the fault detection process is relied on statistical hypothesis tests. The null hypothesis is defined as that the wind turbine is operating in the normal condition without fault. If the null hypothesis is rejected in the favor of alternative, this indicates the occurrence of the fault in the wind turbine. The detection of a fault is indicated by an abrupt change from 0 to 1. In the test decision, the method can monitor one or several key process parameters of the wind turbine simultaneously. A monitoring process for each process parameter use only its own data, thus is independent with the monitoring process for the other parameter. Hence, we do not need to handle the correlation between the selected parameters. Two wind turbine SCADA data sets, including three fault events, were used as a case studies for testing the developed method. In the both cases, various process parameters were analyzed. The result shows that methods can effectively monitor the operation state of the wind turbine and reliably detect the anomaly or fault several days before its occurrence. A second article is extending the Mann Whitney Wilcoxon ranks some test to survey data for comparing mean ranks. Statistical methods for analysis of the survey data have been developed to facilitate research. More recently, Lomele and Scott developed an approach to extend the Mann Whitney Wilcoxon rank sum test to the survey data. This approach focuses on null of the equal distribution. In many studies, Mann Whitney Wilcoxon test is called the two sample t-test, with or without equal variance assumed, failed to provide meaningful result as they are highly sensitive to outliers. In such situation, the null of equal distribution is too restrictive, as interest lies in comparing centers of the group. In this article, we develop an approach to extend Mann Whitney Wilcoxon test to survey data to test the null of the equal mean ranks, not as not as popular as mean and median. The mean rank is also meaningful measure of the center of distribution, is same as the median for symmetric distribution. We illustrate the opposed approach and show major difference with the Rumley and Scott alternative using both real and simulated data. Now coming to our MCQ session. MCQ number 1 is our researcher in Lahore is conducting a study comparing the fasting blood glucose level of the two groups of the patient, one group receiving a traditional herbal remedy and other receiving standard allopathic treatment. The data collected are continuous, non-normal distributed, and patient in the both groups are unrelated. The groups are independent. Which statistically test is more appropriate for comparing the two groups in the scenario? Option A, dependent parametric statistical test is option A, dependent parametric unpaired. Here is the which statistical, sorry, which type of data is most used for Mann Whitney test? Dependent parametric unpaired data, independent non-parametric paired data, continuous non-parametric unpaired data, and categorical unpaired data. Option is continuous parametric paired data.
B. B.
Yes, answer is B. The Wilcoxon hind Wilcoxon signed rank test is non-parametric test for assessing whether two related or paired a sample observation come the same distribution. For this test, both sample size must be greater than or equal to 10, less than or equal to 5, must be 9, greater than or equal to 15, or less than or equal to 15.
A.
Yes, A is the right answer. The parametric test compares the means H naught mu1 equals to mu2 between the independent group. The statistical and probability theory, the median is the value separating the higher half from the lower half of the data sample. A population which among the following tests compare the median between the two populations? Sign test, Wilcoxon sign rank test, Mann Whitney U test, Kruskal Wallis test, and ANOVA test.
B.
C.
C is the right answer. A researcher is studying the effect of the two different teaching methods on the student test scores. Group A consists of the students who were taught using the traditional method, and Group B consists of the students taught using a new innovative method. The test scores are ordinal, and researchers is unsure if the data follows a normal distribution. To analyze the data, the researcher decide to use a parametric test. The researchers collect test scores from the two different groups of the student, one for the each teaching method. Which statistical test should the researcher use to compare the test score between the two teaching groups? Option A, pair t-test. Option B, independent t-test. Option C, Wilcoxon rank sum test. Option D, Pearson correlation test. Option E, Kruskal-Willis test. As the
C.
as the data is normally distributed and two independent groups are there, so it is independent t-test. Our researcher is studying the effect of two different dietary interventions on the hemoglobin level of the two independent group of the anemic adult patients in the Lahore. Group A receiving a traditional iron-rich diet and the group B receiving a fortified cereal-based diet. After 8 weeks, the hemoglobin levels are measured, and the researcher wishes to compare the central tendencies of these two groups, assuming the data is not normally distributed. Which statistical test is most appropriate for comparing the two groups of this scenario? Option A, pair t-test. Option B, Wilcoxon signed rank test. Option C, Wilcoxon rank sum test or Mann Whitney U test. Option D, ANOVA test, and option E, chi-square test.
A.
C, Wilcoxon rank sum test.
Yeah.
A clinical researcher in Rawalpindi is comparing the fasting blood glucose level between two independent groups of type 2 diabetic patients, one treated with the metformin alone and other with the combination of the metformin and dietary intervention. The data is not normally distributed, so the researcher for a non-parametric alternative to the unpaired t-test. Which of the following is the appropriate non-parametric equivalent of the unpaired t-test? Option A, sign test. Option B, Wilcoxon signed rank test. Option C, Mann Whitney U test. Option D, Kruskal-Willis test. Option E, Federman test.
Mann Whitney.
Yes, Mann Whitney is right answer. A clinical trial in the Lahore is conducted to compare the effectiveness of the two independent treatment of the chronic low back pain. The researcher is interested in whether one treatment lead to significantly lower pain score than the other. The pain scores are not normally distributed. The Wilcoxon rank sum test is used. Which of the following best describe the nature of the test in this context? Option A, upper tail. Option B, lower tail. Option C, upper and the lower tail. Option D, paired type. Option E, unpaired type.
Unpaired type.
Yes, it is unpaired type. MCQ number 8 is a Mann Whitney U test. Wilcoxon rank sum test is not same as the Wilcoxon signed rank test, although both are non-parametric, involve the summation of the ranks. The Mann Whitney U test is preferred to a t-test when assumption of normality is not met. Option B, data are paired. Option C, sample size is large. Option D, sample size is dependent. Option E, when data is normally distributed.
A.
Option
Alpha.
A,
A is the right answer. MCQ number 9 is during a study comparing post-operative recovery scores on a 10-point scale of the two independent groups of the patient, one receiving standard care and the other receiving enhanced physiotherapy. A statistician decide to apply Wilcoxon rank sum test. Mann, Whitney, U test. Several patients in the both groups happen to have identical score resulting in ties. In context of the Wilcoxon rank sum task, which treatment above the ties is most appropriate? Option A, tie never affect the decision. Option B, tie within one sample may affect the decision. Option C, ties always affect the decision. Option D, ties between two samples may affect the decision. Ties are handled using average ranks and may slightly affect the test statistics and p-value.
E,
Yes, E is the right answer. Option MCQ number 10 is a public health researcher in Lahore is investigating whether there is a statistically significant difference in the median recovery time between the groups of the COVID-19 patient, one treated with the standard therapy and other with an experimental drug. The groups are independent and the data is not normally distributed. In this scenario, Wilcoxon ranks sum test, also known as Mann-Whitney U test, is used only when the independent sample, only in the matched pair samples, as an alternative to Kruskal-Willis test and to test for randomness when comparing two independent groups without assuming normal distribution.
E.
Answer is
A.
Here's
A,
the key of MCQs. This is a YouTube link of link where all presentations are uploaded. Kindly like and subscribe, and thank you.
Thank you very much, Dr. Marina. This is very good presentation on a very important topic, that is Wilcoxon rank test that we used very often in our many medical studies. However, there are very important gaps that are present in your presentation, and there are many mistakes that should be corrected. If you go to your recent advances, would you please show that slide of turbines, please?
Yes, ma'am.
Meanwhile, I would request everyone to pray for the betterment of your country and do your best as a honest and hardworking student. And you should learn the best skills, because no one knows what happens the next moment, and we don't know whether we are alive the next moment or not. So try your best to do as much good deeds as you can. Don't waste your time in unnecessary things. So Dr. Marina, the most important points that I must highlight is, we have decided when we started these presentations that please mute your mic. All those students who are in the class, please mute your mics. So we have decided that all the examples should be from medical sciences. So these examples be in the light of the medical experiments and the study designs that are done for the human health. As the turbines, they are not related with human health, it should be replaced with some other example where the human health studies are placed. Number second, the MCQs again, there are lots of mistakes in your MCQs. Would you please go to your MCQ number 1?
Yes, ma'am.
Here you are asking in the question about the statistical test, and the options are all about the data. So the data sets and the tests, they are two different things, and it should be crystal clear to everyone what is the STEM and what are the options that are available. The options should be matching with each other. There should be the distractors that are homogeneous. Moreover, they should relate with the question or the STEM. here the stem is different and please correct your mistakes and share your presentation again in the group. Thank you very much for your patient listening.
Thank you so much. Thank you so much.
Thank you very much, ma'am.
Thank you.
Thank you, ma'am.